All right, welcome back everybody to the show. It's a good time here in the island because the good folks from Good Samaritan Hospital from the good state of California, I told you it was good, are here on Guam and they're visiting, and I'm joined right now very proudly to be so by the president and CEO of Good Samaritan Hospital, Andrew Lica, and the cardiologist and medical director, Dr. Juan Carlos Quiros. Gentlemen, happy holidays and Hafa Welcome to Guam.
Happy holidays.
You too. Happy holidays.
Okay, so good for you gentlemen to be here. Let's start off by saying, like what types of medicine do you specialize in and what kind of cases do you undertake?
Sure. So Good Samaritan Hospital is in downtown Los Angeles. We've been there a long time, since 1885. So it's a well-established hospital within the community. And what separates us, I think, from other facilities is really the specialization in really tough disease types, such as cardiac care, cardiothoracic surgery, oncology, orthopedics, neurosurgery, and other types of cases. So that's really where our expertise lies, and it lies not only with the hospital with a program, but with the physicians involved with that program, as well as the entire team. So nurses, technicians, physical therapists, and others. So it's a real team-based setting with about 8 major disease categories.
Mm-hmm. Now, doctor, what kind of cases do you typically undersee, and specifically to your visit here to the island, what are you going to be concentrating on?
Well, basically, I'm a cardiologist, and this is one of my many visits to the island. I've been coming here for over 15 years. I usually come every 2 to 3 months, and what basically I do is cardiology, non-invasive cardiology. I assess patients, more or less triage patients, and those that need further care, we suggest those patients go to a tertiary care center for further care.
And having that knowledge as you have, and having been to Guam so many times now, like what have you taken away as a physician for the types of care specifically that are needed here? Because I was going to go back to Andrew for the next question. Is with Guam having so much prevalent heart disease and things like diabetes and things like that, how do you fold that into your work?
Well, basically that makes my work makes things fairly easy, because there's such a large prevalence of disease here that we always have and will have patients, unfortunately. We wish we can wipe away a lot of those risk factors, such as diabetes or tobacco use or hypertension. However, we're not going to be able to. So meanwhile, we'll have to go ahead and treat those conditions and try and put a little bit of a dent in prevention, at least. For those that unfortunately progress further, that's where we'll come in with the referrals to our centers of excellence.
Mm-hmm. Yeah, and how would you, Andrew, say that, based on these visits and everything, not only to Guam, but other places that you do similar types of outreach to, how does Guam kind of stack up in terms of the amount of work that you get?
I think, well, first of all, it sounds a little bit counterintuitive for a hospital president to say that we don't want the business, but that's exactly what we're trying to achieve by bringing the expertise here to Guam. So Dr. Quiros, and bringing him here on a frequent basis every 2 to 3 months, the objective here is to follow up with his existing patient load, as well as seeing new patients, to be able to try to address disease type early in the early stages. If that's not possible and they require intervention, they come to Good Sam. And unfortunately, many of the patients who come to Good Samaritan, it's our expertise, they're very sick. Mm-hmm. So it's not, sometimes just a single disease state. It's a multi-disease state that they come with, and it provides us with a tremendous challenge with our resources and so forth to bring them back to health. But once brought back to health, again, what we want to be able to do is keep things contained here with the medical community to be able to provide the proper level of care so they don't require external treatment or hospitalization.
Mm-hmm. The technology that's in the medical field is, obviously outstanding, and it's, right there on the cutting edge. How much of telemedicine, are you able to apply? Because the distance is so far. Doctor, I'm sure your frequent flyer miles account is pretty impressive, because you basically come out here, four times a year and everything. So how much can you actually use as far as, video conferencing or, collaborating with colleagues in real time, to treat patients?
Well, interesting. This is what we've been talking about earlier today, about setting up a program or a continuing program in order to be able to assess patients via telecommunication. Ultimately, there always has to be a doctor with a hands-on. There's no question. Mm-hmm. I mean, we'll always say that the doctor has to lay depends upon the patient. But there are certain situations in which we'll be able to communicate through the modern means and be able to assess patients at a distance, at least triage them to a certain extent, make decisions on site, in which make it easier for the physicians here to care for those patients. So yes, definitely telemedicine is going to be extremely important, and we're in the forefront of that right now. We're planning several places that we will institute our program.
All right. Well, gentlemen, we do appreciate your work on behalf of the entire island, and look forward to talking to you again when we will do so many times in the coming
Great.
future.
Thank you very much for having us here.
All
Thank
right,
you for having us.
Happy holidays. It's good that you're
holidays.
doing this work around this time, so hopefully give some people some holiday cheer and give some family members times with their loved ones.
Great.
Thank
All right.
you.
Thank you.
All right, and stay tuned. We'll be